All right, so sexually transmitted infection. Back in the day, I used to not cover this at all. And then a friend of mine worked for a pregnancy center in Lubbock, and they did like educational things, and so she was a nurse, and they were doing this, and so I had them come in and they did their whole thing, and then like it was super interesting, and she's like, yeah, this is important, mostly because of our location. So now we'll talk about it, and just this like warning here, if you've taken micro, I know that at least one of the people that teaches micro, their pictures are far more graphic than mine. Like, they're exceedingly graphic. I will spare you those. That's my gift to you. We'll look at pictures of the actual bacterial cell, but that's as far as we're gonna go here. You're welcome. It's early in the morning. All right, so like I said, World War II posters. And historically, like, these are well-known diseases. There's, when you read about like leper colonies, like in biblical times where they had leper colonies, there's a pretty good chance those people didn't have leprosy. They had syphilis. So yeah, like we've known about this, like we'll look at gonorrhea in just a second. Like gonorrhea is a Greek term. Like it's been well known for thousands of years. So they used to be called sexually transmitted diseases. Before that, they were venereal diseases. So we classify them by the causative agent here. So bacterial and viral being the bigger classes. But you know, there are fungal and parasitic and protozoal things. And some of these aren't commonly transmitted, like the fungal diseases and you know, the fungal diseases especially, they're not commonly transmitted sexually, but they can be. And there's a significant probability of that. But more than that, most, you know, things can be like meningitis, the cold, the flu, COVID could be transmitted sexually. That's not the major means of transmission, so they're not typically considered sexually transmitted diseases, but they can be transmitted that way. Sexually transmitted diseases happen when body fluids are exchanged, and those viral particles or the bacteria are shed in those fluids. Because the mouth and the genitals are mucous membranes, they're not keratinized like the skin, so they're much more permeable to pathogens like this. Anytime there's body fluid exchange, there's significant risk of transmission. The reason these diseases persist in the population is because for many of these diseases, there are no symptoms in about half the people. And if you don't have any symptoms, you don't get treatment, and then you're spreading it. Now you're a vector because you don't have any symptoms. And so this happens a lot where someone is symptomatic, one of the partners is symptomatic, and the other one is not. That doesn't mean that you don't have it, that just means that you're asymptomatic. Sexually transmitted diseases affect men and women of all backgrounds and economic levels. Now, we'll look at some CDC slides later and see this. It is disproportionately affecting different populations. While it does affect pretty much everyone, like different populations are disproportionately affected. It's more so in certain diseases than others, but it is definitely skewed in one direction. And we'll look at that when we look at the CDC slides. They estimate around 19 million new infections happen every year in the United States, and about 60% of those infections are in people younger than 25. The CDC estimates that about 1 in 4 teenage girls in the United States has a sexually transmitted infection. Among those that admit to being sexually active, the rate's about 40%. Between 14 and 19, that ratio of infection from male to female is 2 to 1. And you'll see this skewed also when we look at those CDC slides in the same direction, where so females are much more likely to be infected than males, because that's the direction of fluid transfer, right? The fluids transfer that way. It's easier for men to spread infection to women than the other way around. And while it's not true for all the infections, some of them are pretty much, you'll see twice as many females as you will males. So we'll start with the most common bacterial infection. This is chlamydia. There's the little bacterial cell. Again, there's your picture. You're welcome. Only found in people. Well, you know what? I want to say there's this particular strain is people. I want to say there's another one. I can't remember now. I think maybe it's koalas have chlamydia. I don't remember. I think it's koalas that they have chlamydia, and I don't know if it's the same bacteria.
They can give you chlamydia too.
I don't want to know how that works. But yeah, I've seen last week tonight with John Oliver, there's a whole running joke about koalas with chlamydia, so I'm pretty sure that's it. Sexual transmitted infection, and it's transmitted through childbirth. This is why when your kid's born, they put the silver nitrate drops in their eyes. Because when it's transmitted through childbirth, we get chlamydial blindness. Now, it used to be the leading cause of infant blindness. Not so much anymore because at childbirth, you treat this. Even C-section babies, they come out, drops in the eyes. Even though that's not even a chance now because they're not passing through the reproductive tract, they're coming straight out the uterus and the abdomen, they'll still do this just by default. Drops in the eyes to prevent chlamydial blindness. They estimate around 2.8 million people are infected in the United States alone. Symptoms for females, sometimes painful urination. It will cause inflammation that we call pelvic inflammatory disease, which is inflammation of the uterus and the uterine tubes. But about 75% of women will remain asymptomatic. And when that happens, the bacteria will actually scar the uterine tubes. This can cause sterility, and it causes an increased risk of ectopic pregnancy. Now, this is obviously it's a bacterial disease, so we treat it with an antibiotic. But if you're asymptomatic, you don't know to go get treated. So the disease might persist. For males, symptoms might include inflammation of the urethra, but that's only about half the cases. Mostly of the time, it will be asymptomatic in males. Next to chlamydia, the next most common bacterial infection is gonorrhea. Around 700,000 people in the United States every year get new infections. Now, left untreated, this will spread throughout the body. It will affect the heart valves. It will affect the joints. We get necrosis. When we looked at sort of the necrosis that occurs with plague that we looked at in the immune system or the lymphatics. We saw one of the pictures that we saw was someone with necrosis of the limbs because of gonorrhea. That's way spread out. Most of the time, you're not going to wait that long. So gonorrhea, the word looks like diarrhea. So diarrhea, digestive tract, fluid escaping from the digestive tract, gonorrhea. It's called that because when they named this, they thought what was escaping from men was semen. They assumed that that was what was going on. I've read that the idea was that these women were so virile, they were actually leaking semen. So it's not, it's pus, right? It's an infection. And no, you can't get it from a toilet seat. Between 30 and 60% of people that have this will be asymptomatic. In men, yellow discharge, painful urination. Symptoms may develop a couple days later. They may wait a month to develop. And if you leave it untreated, eventually it can result in sterility. Men have about a 20% chance of catching that infection from an infected female. Women have an 80% chance of catching it from an infected male. More than half the women will have no symptoms or they're ignored or written off as something else, but it can also cause pelvic inflammatory disease and scarring of the uterine tubes and the uterus.
I had a quick question. Are women more sensitive, I guess,
What do you mean?
Like, to getting it, like.
Okay, so they are because that's the direction of fluid transfer, right? Because males are transferring that fluid to women, so if they're infected, like that, it's a direct shot. But for females, like it's got to cross over from males, like the fluid's not coming that way, and so there's more keratinized tissue there for the male than there is for the female, and so it's just less likely that it's going to come back in the opposite direction. And that's not saying that it doesn't, but it's just not as common. The least common of the bacterial infections that we'll discuss is syphilis. It's also the most serious. Syphilis, there's the syphilis bacteria there, little spirochete guy. Before we had testing, diagnosis of syphilis was really difficult because especially in the late stages of syphilis, it looked like a bunch of other things. Leprosy. Syphilis used to be a death sentence. And sometimes you'll watch like old movies where they have someone that has syphilis and they'll have their face covered because of the necrosis that it causes, and we'll see that in a second. It wasn't until the 40s that we could even treat this reliably with antibiotics and we could fix it. We'll talk about that in a second too. All right, so left untreated, syphilis can kill you. It's going to cause damage to the heart, the blood vessels, the brain, the eyes, the bones, the skin, bones and skin, we'll see in just a second. It's significant. The rates of infection dropped off really low in the 80s and 90s, but they're back up again. And we do see like little hot spots throughout the country, the state, and Lubbock's one of them. Actually, yes. So like that term, like radar rash, that's syphilis. This is the only one that's like going to cause like a significant rash. And that idea, however, that somehow like Texas Tech is like well known for this, colleges don't keep that statistic. Like that's not in the brochure, right? But it's still like, I don't know, it's sort of an urban legend thing that's super popularized, but there's not really any data to back that up to say that we're like somehow like worse than the University of Texas or whatever. It's just out there. All right, so primary syphilis causes a sore called a canker. Not normally on your hand. You're welcome. Save any of those pictures. But you can see here, like it's an open sore, like that's a large open sore. It doesn't have to be that large, but it's going to be an open sore, and it'll heal.
But is it going to be like down there?
Yes. Which
Like
again,
on it or in it?
you're welcome. On.
Oh, like on like the
Yeah.
big part or like the tip part?
Anywhere.
Oh.
Imagine.
So, again, like I said, so this is gonna heal. And then most people at this point, freaking doctor, right? Open sore, you're like, hell no. Doctor, and doctor's like, penicillin, you're welcome, have a great day. Fixed it. Some people, whatever, they're like, I don't need a doctor. It goes away. Secondary syphilis. Secondary syphilis causes a rash. Now it can be a serious rash. And this is why like before testing, like this was hard to diagnose because what's that rash? Like there's a bunch of other stuff that causes rashes. And so we get secondary syphilis. Now in the United States, we keep up with statistics for primary and secondary syphilis. Because at this point, right, you should seek medical attention and they're going to treat this. Oh, and I did mention this before. When I talk about statistics here, not all sexually transmitted infections are reportable to the CDC. Your doctor is required to report chlamydia, gonorrhea, syphilis, and HIV. And when I say report, they don't like send in your name. They just have to keep up with the number of patients they treat for epidemiology and stuff. Those are the reportable ones. Like they have to report those. Primary and secondary syphilis, like we'll have numbers on those. And so like when we look at our CDC slides later, that's what you'll see, is we have numbers on those, but we don't have numbers on like all the other infections because nobody keeps track of how many patients, so we kind of have an estimate. All right, should this progress to tertiary syphilis, it's gonna be bad. It's scarring. And like I said, you'll see like movies like where they're in the 1800s where their faces are covered because of syphilis. And there's nothing like at this point. This is bad. It should not have gotten this far today, but back in the day, there was nothing to do. And these pictures are obviously not from the 1800s, so it still does happen, it just should not.
So what would you call that? It's like, what is that called?
That's necrosis.
Necrosis.
All right, so one of the more questionable, it's not even questionable, I shouldn't say that, like just absolutely like ethically terrible studies that's ever been done in the United States was called the Tuskegee syphilis study. There's no questions about it, like this was utter crap. In Tuskegee, Alabama, the Department of Public Health was keeping up with patients that had syphilis. In 1932, there was no like reliable, effective treatment. There were treatments, but they weren't particularly safe and they didn't always work. So we didn't have antibiotics at that point. So what they were doing is they were keeping track of people that had syphilis, this untreated syphilis, and how quickly it progressed. That's fair because there's nothing you can do, so like you're just keeping track of it. By 1947, we had penicillin. We knew that it full-on cured syphilis, and it was widely used to treat the disease. The people holding the study withheld that treatment from patients. And they did that until 1972. So for the next 30 years, they let people die of syphilis when they could have, cured it at any point. Making this, like, the real problem here is the population they were doing this was nearly 100% African American males. While everyone else could get a treatment, these guys couldn't. So this super sucked, it was super stupid. We were learning nothing at the point that they actually ended the study. Anything there was to learn, they probably learned in the first few years of this study. There was no reason to continue it at all, other than to keep these people's jobs. All right, so there are fungal diseases, both yeast infections, which is that Tinea infection, candidiasis is like the standard yeast infection. Tinea is jock itch, ringworm, athlete's foot, all of those things can be transmitted sexually, but that's not the main mode of transmission. Like normally, it's just not that. Like that yeast is sort of endemic anyway, and it just has to overpopulate. So that's not our main mode. There are parasitic diseases, right? The pubic louse there. Much like head lice, they really live on people. They're not very common anymore. I seem to remember a Daily Show bit from several years ago where they were talking to this guy, and this was the organism that he studied as a biologist, and he was having an issue like finding people that were infected the study. So if I remember the story correctly, like he was offering to pay people to infect them with pubic lice so he could study that. Here's your $50. And then he's like, I just can't get anybody to participate. But again, they're not super common anymore. These can also be spread through like clothing. So there's some great stories about people being infected with these from buying like clothing from like Goodwill or whatever. Like obviously wash things, right? If you buy used clothing, wash that. Protozoan, the only protozoan infection we really care about, this is trichomoniasis, that little protozoan thing. Men tend to be asymptomatic, women have symptoms, discharge, pain. Thus far though, all the things we're talking about are like easily treatable. Not a problem, fix it, move it on. Then we start with viral infections. Now, the viral infections are more problematic because sometimes we can suppress symptoms But for many of these viral infections, there's no cure, if you will. Like, it's always going to be with you. Now, that's not true for all of them, but for lots of them they are. One of them that it is true for is the herpes simplex virus. Now, when we talk about herpes, we're talking about infection with either HSV1 or HSV2. Now, when we usually talk about sexually transmitted herpes, we're talking about genital herpes, if you will, and that's typically HSV2. Now, HSV1 can be transmitted and can be genital herpes as well, but usually HSV1 is transmitted through like touch, saliva, close contact, whatever. They estimate that roughly, somewhere between 65 and 90% of the human population has HSV1. You get it when you're a kid. It might cause cold sores, like on your mouth. But most people don't have any symptoms.
Blisters?
Yeah.
Is that what that, yeah.
And like it happens, like it's there, like somewhere between 65 and 90% of us have it. And like you don't even have to, like you just have to touch, like it can be spread hands, like, and then it's on your face. But most people don't have any symptoms. So it's like, I'm trying to remember the stats. I think for HSV1 in the United States, it's like 1 in 2 people are infected, like half of us at the very least. And for like actual genital herpes, it's like 1 in 5. Typically, HSV2 is what we would consider like genital herpes, but like I said, they can infect either place. This persists because about half the people that contract this virus, even if we're talking about like HSV2, like below the waist here, they're asymptomatic. They estimate that asymptomatic HSV2 infection might be as high as 50%. So it spreads. If you don't know you have it, if you never have any symptoms, you can spread it. The disease is easier to spread when you're symptomatic. So when those sores, those little herpes sores appear, you're more likely to spread. You're shedding more virus at this point. And when I say shedding virus, and the reason that this virus like persists in you is it evades your immune system. And it does that by taking residence in neurons. So now your immune system can't touch it, it's in a neuron. And every once in a while, it will kind of get out, and when it does, it travels along the neuron, along the axon, and it ends up in the skin. And so then you have that sore, like on the mouth, or if we have genital herpes on the genitals, and you have that sore, and now you're shedding more virus particles. Even when you're not symptomatic, if you have this, like 10% of the time, you're probably still shedding virus particles. But again, you never have any symptoms. Weird story though, up until the 1970s, this was not, we didn't make a designation here. Like genital herpes was just a cold sore still, like it was just like a fever blister in a weird place. We didn't make any distinction. The only reason I know this is my predecessor here left me some books, and one of them was this CDC book on, and it's a little pamphlet thing on sexually transmitted infections. It's from like 1975. No mention of this whatsoever. So I'm like, why not? And so went down that rabbit hole. So in the 70s, when they developed acyclovir, the marketing department insisted that there wasn't a way to sell this medication. What's genital herpes? Why are we, so they didn't have anything. So the marketing department really hadn't heard of this. And so they went on a whole marketing campaign to separate the idea of like cold sores from genital herpes to sell them their medication. And this today is how we would treat this. Like we use the newer version of this, like, I think it's like valacyclovir, and we suppress symptoms. And when we suppress symptoms, like your risk of transmission is lower when you're not symptomatic. And most people that end up with this, sometimes they have like one outbreak period where it's super painful and then they never see it again. Usually when you're taking the medication, like it's to suppress the symptoms. But I don't know if patients take it regularly. That medication's used for multiple, it's an antiviral, so it's used for multiple viruses. That process though is now, it's called disease monitoring. And they've used it multiple times. So, people just used to go bald and then it became a disease. Male pattern baldness, treated with minoxidil, right? You can go get a prescription for that now. And before it was just like, it was this thing. And now, you can make up diseases, is what it amounts to. All right. Again, you're welcome for the lack of pictures. HPV is the most common sexually transmitted infection. There have been 40 different types of this, and they affect both males and females. They can infect the throat and the respiratory tract as well, but most people never have symptoms. In most patients, HPV will clear itself. Rarely, it can cause like genital warts, also warts in the throat, which is recurrent respiratory papillomatosis. Cervical cancer is highly associated with this. Also cancers of the genitalia, cancers of the throat, all of these can be caused by HPV. Today, we can prevent some of the types of HPV. The ones especially that are associated with cervical cancer, we can prevent with the vaccination. So we get kids vaccinated, both males and females vaccinated for HPV now, and this should greatly reduce the occurrence of cervical cancer. However, those are not the same strains that cause like genital warts. I don't know, went backwards. Oh no. So the most common sexually transmitted infection, they estimate sexually active people, like 80% of them will eventually acquire this at some point. By the age of 50, like 80% of American women have had at least one strain of this. And at any given time, like a quarter of American women between 40 and 59 have an active infection, but most of the time there's no symptoms. It can cause other issues. Like this is one of the things they check you for, right? At your gynecologist, one of the things they check for, because it is so highly associated with your development of cancer. And cancers of the reproductive tract are problematic, whether we're talking about like testicular cancer or prostate cancer or ovarian cancer or uterine cancer or cervical cancer. All of those things can go missed for a while. And when that happens, when the tumor's there, like cervical cancer, the tumor's there, you might not have any symptoms, and it's much more likely to move the longer it persists. So the risk of metastasis is really high. Hepatitis B is the most common sexually transmitted hepatitis. You can get hep C through sex as well, but most of the time, like hep C is like needles and blood. Hepatitis B is typically sexually transmitted. Like any hepatitis, it's inflammation of the liver. Hepatitis A is the food one. But for hep B, you're vaccinated shortly after birth. That's the first shot they give them, I think. And then finally, HIV. Right, HIV is human immunodeficiency virus. It's a retrovirus. So it uses a weird process to go from RNA to DNA, and it means that it's constantly changing, and it's really difficult to vaccinate against. So we're not there yet. This thing infects helper T cells, also macrophages and those dendritic cells, but helper T cells. And as we talked about with immunity, like helper T cells are core to the whole immune system. Gotta have this. When these helper T cells are killed by the virus, your immune system's compromised severely. That's AIDS, acquired immunodeficiency syndrome. So when your immune system sucks that much, it will allow cancer that normally would have been taken out to form. It allows tons of opportunistic infection, and eventually will cause death. So this is a global pandemic. In 2021, about 38.4 people had HIV in the world. Africa is disproportionately affected. Around 2/3 of people in the world that have HIV are in sub-Saharan Africa. It is a massive issue. 650,000 people died of HIV in 2021, or AIDS, I should say, in 2021. Since 1981, more than 40 million people have died.
Are those like people who straight die from AIDS,
Yes.
not a secondary?
Well, so like, if it's like a secondary thing, it's still like, it's still considered.
counted, okay.
Yeah.
I didn't know if they counted it, like, which one?
So in the 80s, none of you remember the 80s, so shut up. But so in the 80s, this was a death sentence. Like, I was a little kid, and it was still like, it was in the news all the time. Like this is a big thing. Like people that were dying of this, like celebrities, Freddie Mercury, right? And like people were dying of AIDS, and it was a massive sort of scare that was going on, and there was no reliable, or there was no treatment at all. Today, that's not the case, right? Today, patients with HIV in the United States, I should say, it doesn't have to progress to AIDS, and HIV patients can live a relatively normal lifespan, albeit with medication, because the medication we have today is remarkable. Now we're still not curing this, but some of the medications that we have today can suppress the virus to the point that you can't detect it anymore. Now you stop the medication and it will come back, but as long as you're taking the medication, it's undetectable. If it's undetectable, hypothetically, you can't spread it either. So that's a massive advancement. We have antiretrovirals and reverse transcriptase inhibitors that do a remarkable job of treating this. This is why it disproportionately affects sub-Saharan Africa, because they don't have the level of medical care that we have here. They don't have the availability of the medications. Which Merry Christmas. I like to end on this. Actually, now what we'll do is we're gonna take a look at some. So, like I said, I don't have the same I'm not gonna share pictures with you like they will on Micro. But what I will scar you with here is some statistics. And this is the surveillance report from the CDC. It's usually a couple of years behind, right? So it takes a while to compile the data. So here's surveillance from 2021. So this is chlamydia from 2020, 2021, compared to 2019. So here's January 2020. You can see it's kind of up and down. And then like March 2020, it goes way down. What happened in March 2020? Right, so this is reported. This doesn't mean that the case numbers are down, it's just that nobody's going anywhere now. And so you see that straight up drop there. And then, so throughout that, like there's, like, as it,
They let us breathe?
yeah, you can see that, and then these little spikes coming back. Compared to 2019, here it is on like rates 84 to 2021. This is when it starts being reported. So it's not an artificial thing. So like down here, it looks like there's nobody. It's not that there's nobody. It's just that we weren't reporting it. And then as people started reporting it, like here's that, and then like this upward thing. Again, drop off there. COVID. It's coming back. Here it is men to women. Again, that rate is much higher in women than it is in men. Reported cases. That doesn't mean cases, that means reported cases. So men tend to be asymptomatic, so those cases aren't being treated. Here is region in the United States. Incidentally, on the CDC map, we're in the South. So winning. Again, male and female based on age. So your highest rate 2024 in any demographic here, 15 to 19 for women is in second.
2 years ago.
Where about that one? Here it is based on race, ethnicity. Again, disproportionately affecting minorities, especially African Americans, highly disproportionately affecting. And again, this is a failure of the system. This is an easily treatable thing, and prevention's pretty straightforward. You'll see this throughout lots of them. Here's that again. Here's it by state in 2021. What this tells you is like Texas, it's not awesome, but at least we're better than New Mexico. Here's this progressive map. Here it is by county. You can pick out Lubbock pretty easily. It's one of the darker squares. I don't know which one. It's one of those. Alright, so let's move on to, oh, there's gonorrhea. I missed it. So here's gonorrhea reported cases by year. Coming back as well. In gonorrhea, this tends to be reported in men more often than women because, again, you've got like an obvious symptom here with like discharge, like you're going in. Again, south. And then here's this distribution again. Again, race, ethnicity. And then by state. By county, again, pretty easy to pick up Lubbock. Alright, so let's see. These are antibiotic resistant strains, so we're not going to get into that. This shows what antibiotic they're resistant to. Lots of strains of gonorrhea now are resistant to certain antibiotics. And that's just the percentage of which ones are. Oh, and then here's syphilis. So here's syphilis by stage of infection. So total syphilis there in gray. So like I said, what happened here? Antibiotics. Treat it. If it's treated, you're not spreading it, so now rates are way down. It is, however, picking back up again at the moment. So here's 2012 to 2021. Like I said, there's an uptick right now. Again, primary, secondary. There's our COVID dip. And then reported rates, cases by gender. Again, that primary syphilis infection, like that giant sword, like you're going in. Here we're not, like we're still in the South, so I mean, it could be worse. Age group, ethnicity. We're much better than New Mexico here. Here it is by county again. Actually, for whatever reason, this is an issue. Like the rates in Lubbock are continually higher than surrounding areas. So this is not even going to include HIV, and we're not going to get into all these other steps. This is congenital syphilis. Congenital syphilis you're born with, and that needs to be treated. And these are also on the rise. All right. So, like I said, statistics are scarier. All stages of syphilis. And again, we're in the South for these maps. There's a Texas one as well that we won't look at, but there's one for just Texas that kind of shows it by county. But it's an interesting progression, and because you're here, it's gonna be something that comes up, because we do tend to have higher rates in this area. For whatever reason, that's the case. All right, so this will wrap up stuff. On Thursday, we'll review. So that's it for now. Take a break.